Is a urinary tract infection a sexually transmitted infection? The simple answer is no. Hello, I'm Ifeanyi and welcome to Wellness by Nwasike Ifeanyi. Then let's start by discussing what the urinary tract is. The urinary tract is a system that is responsible for the production, storage, and removal of urine from the body. It consists of four main parts: the kidney, that filters excess fluid and waste products from the blood; the ureter, through which urine gets to the urinary bladder; the urinary bladder that stores urine; and then the urethra, through which urine leaves the body. Now, what is a urinary tract infection? The urinary tract infection is caused by a bacterium called the Escherichia coli. These bacteria live in the intestines and they help with digestion. They are harmless when they are in the gastrointestinal tract, but where the problem begins is when they gain access into the urinary tract through the fecal urethral transmission. Now, the human feces contains those bacteria, so they can move from the anal region or surrounding skin to the urethra, and when they gain access into the urethra, they ascend to the urinary bladder where they multiply and begin to infect the urinary tract. And if this condition is not treated, it can affect the kidney, leading to a more severe condition. Now, the sexually transmitted infection is an infection that is transmitted from one person to another through sexual contact or intercourse. Examples: chlamydia, gonorrhea, syphilis, HIV. Now, since this urinary tract infection is not a sexually transmitted infection, then why do people get it after sex? This is where the confusion comes in. Now, sex doesn't cause urinary tract infection. It can only move bacteria present around the anal or genital region towards the urethra for easy access into the urinary tract. Think of it this way: sex doesn't cause urinary tract infection, but it makes it easy for those bacteria to gain access into the urinary tract. Why are women more likely to develop urinary tract infection? Now, the reason is because anatomically, women have shorter urethra compared to men. So bacteria only need to cover short distance before they get to the urinary bladder, where they multiply and begin to infect the urinary tract. And then secondly, the distance between the urethra and the anus is not far. So bacteria can move from the anus or the anal region to the urethra easily. Then some of the symptoms, let's divide the symptoms into when it has become severe, that's when it has affected the kidney, and when it has not affected the kidney. So symptoms when it has not affected the kidney include: 1. Pains or burning sensation when urinating. Pains or pressure around the lower abdomen or pelvis. Frequent urination. Small amounts of urination. Cloudy urine. Strong smelling urine. Hematuria, which is blood in the urine in some cases. But when it has affected the kidney, symptoms include chills, it includes fever, it includes nausea and emesis, as urge to vomit or vomiting, right? Urge to vomit and vomiting, as nausea and emesis. And then pains around the side or back below the ribs. These are the signs. And then, how can this condition be actually prevented? Now, the ways you can actually reduce the risks of developing urinary tract infection include: number 1, hydration. When you hydrate yourself, you drink enough water daily, you tend to urinate frequently. And urination is just like the system way of flushing. So if bacteria have gained access into the urethra, when you urinate, you tend to flush the urethra. And secondly, holding urine for too long. You stop holding urine for too long. Now, holding urine for too long turns the urinary bladder into breeding ground for those bacteria. So when you don't hold those urines, when those bacteria are there, you tend to excrete them, so preventing them from multiplying. And then another one is learn to urinate after sexual intercourse or after sex. Very important. And then keep the genital region clean and stop using harsh soap around that region. And then the last one, most especially very important for women, learn to wash from front to back and not from back to front to prevent the bacteria moving from the anal region to the urethra, where they can gain easy access into the urinary tract. If you found this video helpful and educative, please like, share, and subscribe. And I'll see you in the next video.